So now we're in our last chunk for this chapter where we get into various conditions found in the respiratory system. So let's start with the upper respiratory tract and some infections that can happen there. Now we say infections, we're talking about some sort of pathogen, some sort of pathogenic agent that's causing a problem. You'll notice that there are some similarities in the names. Remember that itis, we've talked about itis before. Typically we're thinking infection or inflammation. So sinusitis, right, there's a blockage, there's infection or inflammation of the sinuses. Otitis media, those are going to be infections of the middle ear. Tonsillitis, there's that itis again, inflammation of the tonsils. Sometimes that requires a tonsillectomy, which is a removal of those tonsils via surgery. And laryngitis, something that you may hope that I develop at some point so that you don't have to listen to me so much, where you have an infection of the larynx and this leads to voice loss. Right? If you have laryngitis, you typically can't talk very well. As we move to the lower respiratory tract, we have a couple other disorders we can go into. Acute bronchitis. Now, acute, we're talking about something happening relatively soon, relatively short period of time. So acute bronchitis is an infection of the primary and secondary bronchi. Pneumonia, this is viral or bacterial, and the bronchi and the alveoli actually fill with a thick fluid. And then one that we've already talked about, so we won't go too far into details with, is tuberculosis. These are bacterial infections. You find little tubercles, hence the name, caused by Mycobacterium tuberculosis that causes these bacteria to live in these little encapsulated areas inside the lungs. Super hard to treat. You're looking at a long period of treatment and multiple people having to be treated if they were in the house with you. So this is what some of these guys look like, as we'll go into some of the ones that we haven't talked about just yet here in the next slide, but we have talked about pneumonia, right? And you see that those alveoli are filling with pus and fluid, and so that's going to make gas exchange really hard because you have a fluid and you have pus that's in the way. Pulmonary tuberculosis, again, bacteria is in the way, forming those little tubercles, and so the lungs are not as elastic as they were before. Bronchitis, again, the airways are inflamed because there's some sort of infection, and so there's a lot of mucus, there's pus, and that stuff can be coughed up. We also have restrictive pulmonary disorders in which your vital capacity is reduced. Remember, vital capacity means the maximum you can breathe in and out. So in a way, the lungs are not able to fully expand the way they used to. The lungs have lost elasticity. And there's a few causes, there's a few conditions related to this. Pulmonary fibrosis is one. This is where connective tissue starts to build up in the lungs, and this can be because of inhaled particles, so sand, coal dust, asbestos, fiberglass. This is one of those reasons why you see people wearing those masks when they're working with certain things, because inhaling those particles can lead to connective tissue building up in the lungs. And the more connective tissue builds up, the less elasticity the lungs have, and the harder it is to breathe, essentially. Obstructive pulmonary disorders is where the air does not flow freely. And so that's going to be things like chronic bronchitis, which an irritant or something is causing inflammation of the bronchi, emphysema, asthma, and chronic obstructive pulmonary disease, or COPD. We can't go talking about the respiratory system, and we can't talk about restrictive diseases without talking about tobacco. So tobacco, most people think of tobacco, they think of cigarettes, they think of smoking. I'm here to point out that all forms of tobacco do cause damage, although we are focusing on cigarette smoke, the inhaled version of tobacco use. But use of tobacco can increase your chances of lung cancer, mouth cancer, larynx cancer, esophageal cancer, bladder cancer, kidney cancer, pancreatic cancer, stomach cancer, and cervical cancers. So overall, it's not just your lungs you have to worry about. It's pretty much everything that you have to worry about if you consume tobacco products. It also increases your chance of chronic bronchitis, emphysema, heart disease, stillbirths, and harm to an unborn child. One of the common things is low birth weight. So what are some of these conditions that are most definitely tied to smoking? Emphysema is one. This is chronic, so it's a long-term condition, and it is incurable. There's nothing that can be done to get rid of the damage, to fix what's happened. The alveoli have been damaged, they're distended, and so there's less surface area for them to perform gas exchange. The less surface area and the less gas exchange that happens, that means less oxygen actually gets into your bloodstream. And if there's less oxygen getting in your bloodstream, that means that your heart and your brain are also getting less oxygen. And one of the most common causes of emphysema is smoking. One of the things that could be done for something like this is a lung transplant. However, if someone is a smoker, the odds of them getting a lung transplant is pretty dang slim. Asthma is not necessarily linked to tobacco. It's not necessarily caused by tobacco, although tobacco smoke will make it worse. Asthma is where someone will have problems with wheezing, breathlessness. Sometimes they'll cough, sometimes they'll have mucus. And again, it's because the bronchioles are kind of spasming because of something, pollen, smoke, and that's why they tell you, especially here in the valley, that when we have those really smoky days because of fires, that people that are sensitive, like those who have asthma, should not necessarily be outside. Now, asthma is not curable, but it is treatable, right? Through use of albuterol, through use of inhalers that can help kind of limit those spasms of the bronchioles. The one that really ties in with tobacco use, though, is lung cancer. We already have described cancer in a chapter before where we talked about cancer being uncontrolled or unlimited cell division, right? And so lung cancer is just that, but happening inside the lungs, where there are some sort of cells found in the lungs that are forming a tumor. That tumor starts to grow. Usually it starts in just one single location. However, it can start to spread, in which case it has metastasized. And if it does, right, if we get to that point where metastasis has happened, it can be much, much harder to treat. However, if we catch lung cancer before that spreading occurs, we can undergo what's called a pneumonectomy, which is where they take away a lobe or even an entire lung. So remember that the right lung has 3 lobes, the left lung has 2. They could remove some or even all, well, not all 5, but they could remove some of those lobes if absolutely necessary. And so this is the difference that we see between a healthy normal lung and one that has lung cancer from someone who was a long-term smoker. You see on the normal lung, which is this nice red fleshy looking lung, this would be able to expand very nicely and easily, whereas on the other side it's very blackened. It almost looks like it has fractured in pieces. It looks like it's almost peeling away from itself. And we see that tumor, we see that growth happening there almost in the middle. That should not be there. So overall, for smoking, if you do it, it's no better time to quit than today.